My name is Lauren Van Hove, and I am a third-year medical student at USD Sanford School of Medicine. I'm here with you all today to present my poster titled "A Cannabinoid Type 2 Receptor Agonist Augments NOS-Dependent Responses of Cerebral Arterioles During Type 1 Diabetes." As you all may already know, one of the risk factors for an ischemic stroke is diabetes. Normally, cerebral blood flow matches metabolic demand. However, in type 1 diabetes, oxidative stress is increased, which causes impaired endothelial and neuronal nitric oxide synthase-dependent arterial dilation. Since reactivity of the vessels is impaired, flow fails to match metabolic demand as it normally would in a healthy system, thus increasing the risk for ischemic stroke. While previous studies report that activation of CB2 receptors may be neuroprotective, no studies have examined whether this neuroprotection may be directed at specific components of the neurovascular unit. Thus, our first goal was to examine whether eNOS and nNOS-dependent pathways could be influenced by activation of CB2 receptors. Also, no studies have examined whether activation of CB2 receptors can influence cerebral vascular function during type 1 diabetes. Therefore, the second goal of our study was to examine whether activation of CB2 receptors could influence reactivity of cerebral resistance arterioles to eNOS and nNOS-dependent agonists during type 1 diabetes. Our hypothesis was that administration of a CB2 agonist would improve impaired endothelial and neuronal dependent dilation of cerebral arterioles during type 1 diabetes. For our experiment, we used male Sprague-Dawley rats and created two groups, a non-diabetic group and a type 1 diabetic group. We induced type 1 diabetes into the diabetic group through injection of streptozotocin, which damages pancreatic beta cells, resulting in hypoinsulinemia. 12 to 14 weeks after injection, we began our studies. In both groups, we performed a craniotomy over the parietal cortex and measured the reactivity of the arterioles to ADP, which is the eNOS-dependent agonist, NMDA, which is the nNOS-dependent agonist, and nitroglycerin, which is the NOS-independent agonist. We then injected the rats with either a CB2 agonist, the JWH-133, a CB2 antagonist, which is the AM630, followed by a CB2 agonist, the JWH, or just the vehicle, which was ethanol. We then again measured the reactivity of the arterioles to ADP, NMDA, and nitroglycerin. Looking at our results, the top graph shows that the magnitude of vasodilation produced by ADP and NMDA were significantly less in type 1 diabetic rats, represented by the solid black bars, compared to non-diabetic rats, which are the solid white bars. And so that would be comparing the solid black to the whites. This was similar to what previous studies did report. In addition, our results showed that treatment with a CB2 agonist, the JWH, increased the magnitude of dilation of cerebral arterioles in response to ADP and NMDA in both non-diabetic and type 1 diabetic rats. So that would be comparing this white bar to this bar, this black bar to this bar, and so forth. The graph below shows that treatment of the CB2 agonist caused a larger magnitude of dilation with both ADP and NMDA in diabetic versus non-diabetic rats. So the diabetic difference would be the black bar, and that's compared to the non-diabetic difference, which is the white bar. In conclusion, our studies reconfirmed that reactivity to eNOS and nNOS-dependent agonists is impaired in diabetic compared to non-diabetic rats. We found that treatment with the CB2 agonist enhances responses of PL arterioles to eNOS and nNOS-dependent agonists in both non-diabetic and diabetic rats, but to a greater extent in the diabetic rats. We also found that influence of activation of CB2 receptors on cerebral vascular function can be attenuated by treatment with a specific antagonist of CB2 receptors. So overall, we believe that treatment with CB2 receptor agonists may have potential therapeutic benefits for the treatment of cerebral vascular disease that can contribute to the pathogenesis of stroke and type 1 diabetes. That is the end of my presentation, and thank you all very much for your time.